Bartonella buddies! I know from personal experience that bartonellosis is a painful illness, physically, emotionally, and mentally. Ding ding ding! The trifecta of misery. Most of us are in treatment for anywhere from 6 months to many years, and it's hard to hold on to hope. So I thought I would make a video telling you case reports about patients who have had debilitating symptoms who went on to defeat Bartonella. That way, anytime you feel sad or hopeless, you can come back and watch this video, because there is hope. And I think a lot of the symptoms from these case reports will resonate with many of you. And according to one of my BLMDs, it is rare that bartonellosis causes long-term damage, so that should give you hope as well. And without further ado, let's go into the first case report, which is about an 18-year-old woman. She had a 4-year history of slowly progressive neurological and neurocognitive abnormalities. She had severe headaches, back pain, joint pain, muscle spasms, reduced sensation in her hands, and she could not extend her fingers due to stiffness. She suffered from depression, anxiety, and dizziness, and she also had visual and auditory hallucinations. Over time, her hallucinations became more frequent and more severe, and then they were accompanied by dissociative episodes of 1 to 2 minutes. A dissociative episode is a brief moment when a person experiences a disconnection between their thoughts, identity, consciousness, and/or memory, and these episodes aren't under the person's control. In January 2009, she was tested for bartonellosis and she was found to be PCR positive. She then went to a neuro-ophthalmologist because she had decreased peripheral vision. And in June 2009, she went to an infectious disease doctor who gave her an 8-week course of doxycycline and rifampin. After starting the antibiotics, her hallucinations decreased in frequency and she regained the ability to extend her fingers, so they were on the right track. In June 2010, she was found to be bacteremic again, so she was retreated, this time with rifampin and azithromycin for 4 months. With this therapy, her hallucinations stopped completely, she had no more dissociative episodes, and her peripheral vision returned completely. During the 9-month follow-up period, she returned to her pre-infection baseline. So I know that this is supposed to be a success story, but I do have to tell you that she had a relapse of bacteremia, but not of symptoms. And this was written almost 10 years ago, so we've learned a lot about treatment since then. The treatment that she was given back then is not as up to date as she would get today with a Bartonella literate medical doctor. The next success story is about a 27-year-old female veterinarian who had mostly worked treating domestic animals like cats and dogs, and she had participated in research dissecting lions, giraffes, and mongoose, oh my! And also rabbits and other animals. She also had fairly high exposure to all types of biting insects. There's a reason they're called bugs. In September 2010 in South Africa, she experienced a headache that lasted for an entire 2 weeks, along with light sensitivity, muscle twitching, and tonic-clonic seizures. When I first read tonic-clonic, I didn't know it was tonic-clonic, 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 or tonic-clonic. So out of those 4 permutations, it's tonic-clonic, and obviously you can remember it as gin and tonic-clonic. And gin and tonic-clonic seizures are the type of seizures that we normally think of when we think of a seizure. She was diagnosed with herpes simplex encephalitis, and encephalitis means brain swelling, and she was admitted to the ICU where she was given many mumbling mice are making merry music in the moonlight. My teen eyes done. Many mumbling mice are making merry music in the moonlight. Done. Many mumbling mice are making merry music in the moonlight. My teen eyes. So she was not given many mumbling mice, she was given many medications to manage her symptoms. She was tested for many infectious diseases, including Ebola, Lyme disease, rickettsiosis, and Rift Valley fever. Look at the Rift Valley, it's so pretty. It's in Ethiopia. She was also tested for equine viral encephalitis, African horse sickness, and rabies, and all were negative. They discharged her from the ICU, but 1 month later, she continued to have mild seizures, tremors, impaired coordination, memory loss, and left-sided weakness. Her seizures became more violent, lasting at least 10 minutes, and they occurred 4 to 7 times per day. They were induced by loud noises, bright lights, and long car rides. And I wanted to read this to you from the case report. While hospitalized, a psychologist recommended further personal counseling, as he felt that the patient needed to come to terms with post-encephalitic seizures and inability to be active and live the life she experienced before becoming ill. I wonder if that was a little premature on his part. When traveling from South Africa to Grenada, she had a seizure in the JFK airport. And then, after arriving in Grenada, she was airlifted to Trinidad in status epilepticus. While in the hospital in Trinidad, the doctors were able to manage her symptoms, but no one thought to look for or treat a potential underlying infection. That will probably sound very familiar to most of you. She later returned to Grenada, and she ended up meeting the researcher that ended up writing her case report at St. George's University when the researcher was there to participate in a research collaboration. The veterinarian told her story in a casual conversation, and she was subsequently enrolled in a study on Bartonella in veterinarians as they are a high-risk group. When the researchers first tested her, she was IFA positive for Bartonella, but she was PCR negative. But she was PCR positive for 2 other vector-borne diseases, including Anaplasma platis and Candidatus, or is it Candidatus, Mycoplasma hematoparvum. When she was retested a month later, she was PCR positive for Bartonella henselae. She was then started on doxycycline, and in the first week of therapy, she had an exacerbation of her gin and tonic-clonic seizures, accompanied by disorientation and severe migraines. After that week, she experienced seizures less frequently, and her thoughts were more clear. Doctors found that she had osteolytic lesions on multiple joint surfaces in her wrist, and osteolytic lesions are punched out areas of severe bone loss. And she was also found to have generalized osteopenia, which is lost bone mass. The lesions looked like lesions that are commonly found in immunocompromised patients with Bartonellosis, such as in AIDS patients. She had surgery on that wrist, but then she developed chronic regional pain syndrome, which is pain in a limb that usually occurs after a trauma like surgery. After 6 months on doxycycline, she was able to have a more active lifestyle, her cognition had improved, and she was more alert. However, she was still found to be PCR positive for Bartonella, and the researchers hypothesized that this is because doxycycline alone is not a consistently effective antibiotic for the elimination of Bartonella. The researchers state that she was not started on clarithromycin and rifampin, which is a more effective antibiotic combination for the elimination of Bartonellosis, because it could interfere with her anticonvulsant meds. So the case report ends with her being able to transition off of her anticonvulsant medications, which is a huge win. I would like to imagine that she then was able to treat with clarithromycin and rifampin, but I'm making that up. And I saved the best for last. This case report starts in 2010, and the patient was treated for approximately 2 years and was monitored all the way up until 2018. So we are able to see the remission of her symptoms for around 6 years. Here we have another veterinarian. She was 29 years old when her symptoms began, and they progressed over 2 years. Her symptoms included inflammation in the fluid around the tendon in her forearm, snapping elbow, fatigue, headaches, tingling, and muscle and joint pain. She refractured a bone that had previously healed, and it did not re-heal, and she was experiencing multiple joint subluxations daily, which are dislocations. She was evaluated at Harvard and Johns Hopkins for Ehlers-Danlos syndrome, and the EDS experts there said that she met the criteria for EDS hypermobility type 3. Ehlers-Danlos syndrome is a group of connective tissue disorders marked by hypermobility in the joints, stretchy skin, and tissue fragility. There are 13 subtypes of Ehlers-Danlos syndrome, and all of them are associated with a genetic mutation except for the hypermobility kind called HEDS, which is the kind that this veterinarian was diagnosed with. She was also previously diagnosed with benign breast cysts. At the time that she was entered into the research study, she was unable to work and perform daily living activities. She was tested for Bartonella 17 times over the course of 3 years. She was first tested in May 2010, and she was PCR positive for Bartonella cholerae, but she was IFA negative on all species tested. At this time, she was wearing wrist and elbow braces on both sides, and she had swelling in her extremities, and she had cervical lymph node enlargement, and she was being considered for surgical interventions for her condition. Based on her PCR test, she was started on azithromycin, rifampin, and minocycline, and 4 weeks later, her pain began to decrease. In September 2010, after being on antibiotics for approximately 4 months, her joint hypermobility mobility completely resolved, and that doesn't typically happen with EDS. And her refractured bone re-healed. So this is obviously all great news, but she had some setbacks throughout treatment, but it all turned out good in the end, so stay with me. Over the next couple of years, she intermittently tested PCR positive for Bartonella, and her breast cyst was aspirated, and Bartonella was amplified from the fluid. The authors of this case report hypothesized that her recurrently being PCR positive throughout treatment could have been due to the following: bacterial resistance, antibiotic treatment failure, poor tissue penetration, intermittent release of bacteria from tissues such as the breast cyst, or a combination of these things. Due to persistent bacteremia, antibiotic therapy was changed to clindamycin and rifampin. And now for the good news! Several months later, she discontinued antibiotic therapy in order to get pregnant. She delivered a healthy baby, and EPCR and IFA serology were both negative from the umbilical cord blood and her blood. As of December 2016, about 4 years after stopping antibiotic therapy to have her baby, she has not had positive IFA or EPCR tests. And as of February 2018, she has not had any recurrence of her rheumatological symptoms. Yippee! I plan on making more of these types of videos based on patient stories whose stories have not been written about in the scientific literature. If you have a personal Bartonella success story to share, I have made a Google form, which is basically like an online survey, and you can fill it out, and then I can use that information in my next video and tell your story in a similar format in this video to this video. You get it. Also, if you know someone who has a Bartonella success story to share, please send them this video or the Google form so that they can fill out the Google form. You can find the link to the Google form in the video description box below. Sharing your story will be really helpful to people in the thick of their illness to show them that breaking down Bartonella is possible. If you're new to my channel, my name is Jake, and I would love for you to be my Bartonella buddy, and there are 2 ways to do that. The first way is to hit that subscribe button and click on the notification bell so that you're notified every time I post. The second way is you can add yourself to our Facebook support group called Breaking Down Bartonella, and the link will also be in the video description box. Thanks for watching! It's past Piper's bedtime, so let's see if she will say goodbye. Bye, Bartonella buddies! Okay.
Don't look at me. Don't look at me.